Assalamu alaikum. Thank you very much for joining us for today's session. We have with us Mr. Anam Haleem, who looks after the communication for Khan University Hospital. And Anam has to his distinction to be working on the com side for a very tricky sector, that's PR in health. And we thought give Anam this opportunity to come in and help us understand how PR operates in a health environment, especially. Or thank you very much, Anam, for taking out this time and joining us today. So, without further ado, my first question to you is communication and PR a new phenomenon in the health sector?
So no, I don't think it's a new phenomenon because if you talk about health and if you talk about people's well-being and healthcare in itself, we deal with human beings, we deal with their lives, we take care of patients. So ultimately, it has to do with taking care of them. So instead of promoting services, instead of marketing, oh, we do surgery, you talk to them and you take care of them and be empathetic to their situation. So no, it's not a new phenomenon. PR in healthcare, और अगर मैं as a principle की बात करूँ, तो PR in healthcare has been there for a really long time now. Even though now that it's picking up because in the past decade or so, जब से social media, digital mediums आना शुरू हुए, so people are now much more focused on listening to the stories of healthcare providers, patients, hospitals in general. So yeah.
All right, cool. Acha, and on to my next question is, when developing communication, what is the formula behind taking highly scientific and medical terms and converting them to easily understandable layman language? So whenever there's a pandemic, whenever there's a new disease, there's a new drug that's being formulated, so we see highly scientific names out of it. And then how do you guys, convert into a layman's term so that general population may have a better understanding of what is being talked about?
So, Khurram, I think this is a very good question because every time we're developing a communication piece, material, strategy, the first thing we ask is, would you as a layperson understand what this piece says? To the point कि अगर हम लोग diabetes की भी बात कर रहे हैं, and if you're reaching out to lay people, we say कि भाई diabetes आपकी ज़बान में sugar का मर्ज़ है. So, and when you talk about drugs on its own, उनकी तो एक अलग ही पूरी science है. तो उस side पे तो I won't even go. But I will talk about diseases in general. So what happens is that for us at AKUH, we have some really wonderful experts. And if you're familiar with the hospital, you know AKUH is one of the best hospitals in the country. It provides all services all under one roof. So we get to sit with our experts and we learn from their experiences. So for example, if they get patients who do not understand, so they have to get down to their level to make them understand, and we learn from their experiences, and that's how we then translate it into our communication. And patient education is something that we're very big on anyway.
All right, cool. So that's where you're actually having the target audience teach you as to what's the best way of communication. So that's a very interesting concept.
Absolutely.
Because usually what we see from a PR perspective, from whenever designing communication, it's usually a communicator has a predominant understanding of what the target audience may would want to hear or may want to understand, and then they go on devising that piece of communication and then relaying it out and then kind of gauging on whether that communication actually was effective or not. So it's interesting to know that you guys are actually listening before even developing a piece of communication. You are actually listening to the people that you're going to target that piece of communication to.
So Khurram, I think this is how अगर हम लोग effective communication की बात करें, and healthcare is so specific. It is so specific. It's not like you're promoting a brand. Promoting brands is a very different tangent all on its own. But when you talk about healthcare, it's so specific that you have subject matter experts. So if I'm a subject matter expert on comms and PR, my experience would help our experts. And our experts, as they are subject matter experts in treating patients, their experience helps us. So we learn from each other, and then we collaborate, and then every single piece that goes out from the hospital, it is in line with what the doctor has experienced and what we think would work with our audiences.
All right. Acha, so we saw a critical role in communications during the pandemic also globally, right? So globally, there was a lot of communication that was done with this COVID thing, and then the vaccines came out, and obviously the world is still reeling in from the after effect, and then we are hearing about Omicron, that's the new variant. Uh, in a country like Pakistan specifically, where the literacy rate is not very high, people are usually not very health savvy, I dare say, and then people think that health is something that could just come in, and obviously there's this religious onslaught onto that as well. What challenges and have you seen, and how you guys try to the way that you tried overcoming those? I would not say 100%, but what was your thought process?
So, and Khurram, you've been following the news. You've been a part of this pandemic as well. We were literally in the eye of the storm as healthcare providers, and not just AKUH, but all other healthcare facilities in the city, in the country, the government. The biggest challenge that we had was to deal with information, misinformation, and disinformation.
Hmm.
To the point कि एक बंदा उठ के कह रहा है कि नहीं कुछ नहीं है, this is just a hoax, and we're like no, come on, we have data to show that this is literally killing entire world. What are you talking about? And then there are other aspects, okay, cultural, social, religious aspects are there चीजों के. So we really had to break every single thing down to the point कि अगर हम लोग COVID-19 की बात कर रहे हैं, it's coronavirus disease 2019, so we had to explain what the disease was. Then I think the biggest challenge for us was educating our audiences, educating the public. And AKUH actually took a leading role in doing that. Our experts were constantly on the media. They were advising governments. We were supporting them in creating materials. We were to the point. There's a really interesting story that comes to my mind. I think this was in the very early days of the pandemic when the masks became mandatory. So we developed this visual of how to wear a mask. You will see that visual in Zena Market. And I think a few months ago, some of my friends, they were traveling up north. They even saw it in Gilgit. So that colleague of ours, जिसकी तस्वीर लेके हमने वो visual quickly बनाया था, it became so popular that literally from Zena Market to Gilgit Hunza, you will see that visual everywhere.
Cool. Achha, Anam, based on this, sorry for interjection, but for the understanding of us, and especially because it's gonna go on PR Digital Academy, there are a lot of people, there are a lot of students which are part of the academy. They want to learn how to become the best communicators if they can, and within your experiences. So now, obviously, we understand there are anti-vaxxers, there are people who have got who are anti-science, there are again flat earthers bhi hain. When you have this bunch of population together, especially in a city like Karachi and a country like Pakistan, where literacy is a challenge, so do you go and segregating the target audience and developing specific communication for each one of them? Yeah, it is one formula that fits everybody. So and then you also spoke about secondaries के अंदर बात ये है कि you talked about creating a visual. How do you guys went on deciding कि maybe a written word may not work and a visual would do the best? So do you guys have some principle at work?
Absolutely. So currently, here's the thing. It's not a one-size-fits-all ideology, ever. Especially in healthcare, because you have people, और अगर हम लोग market segmentation की बात करें, you have people from SECA, and then you also have people who probably don't even fall in any one of those. So you have to reach out to everybody, because when you're talking about public health, you have to cater to each and every one. And you want them to know that there are healthcare facilities out there, despite your beliefs or ideas. So yes, you're absolutely right. During the pandemic, because the situation was moving so quickly, we had to develop materials also very quickly. And in that moment, one of the most important decisions that we had taken was that we are going to focus more on visuals, because uh, visuals have the power to reach more people and connect with more people. Yes, you need to have supporting text with it, but it's not as important as the visual, because the visual gives that idea very quickly. So you can cover the larger part of the audience.
Agreed.
But then again, there were certain categories, certain segments ki jinko hum log, obviously you need to have that written content.
Acha, usually what we see, especially brand communication के अंदर या when we talk about services communication, so it's usually what we see is majority of the communication is one way. So you're just throwing out pieces of information out there through various means and methods and tools and all. With health, there's always a feedback mechanism that is coming your way too.
Yeah.
So can you give us an example ke has how you guys tackled with maybe dispelling myths, or maybe the disinformation era that we are living into? There's so much going on when somebody's trying to communicate one thing, and there's entire groups kind of form within subsections of the society, and there's a continuous feedback. So how do you guys deal with that feedback? Is there a way that you guys address those?
So, so there are multiple channels that people can reach out to us. Number one, and the most popular for us, is our Facebook channel. On a regular basis, we receive around 100, 200, 200, 300 queries on our Facebook inbox. And through those, a lot of times there are requests, a lot of times there are complaints, a lot of times there are feedbacks. Now then, everything is then divided into where it needs to go. So for example, if there's a patient feedback, it goes to our patient feedback team. And then that team is responsible for resolving any issues that the patient might have faced. Or if there's anything they need to do further to facilitate and to support the patient. If there are requests like, I need to book an appointment and I could not get through to your contact center, so then that goes to the appointment booking team. So there are different areas demarcated specifically for specific kind of information. And then obviously we get lots and lots of media queries, especially during the pandemic. So we take care of those as well. And then obviously we reach out to, and we act as a bridge between each and every function.
Okay. And you guys are also responsible for responding back to the queries
Absolutely.
on social media and everything.
Absolutely.
All right. So, understanding this, we saw कि एक तो दो तीन तरह की communication है. You guys are into community development as well. There's a lot of CSR that is happening. There's a lot of uplifting the lower segments of the society, which your organization goes into. And then there's general communication, and then there's you're reaching out to different people, and then there are international vaccination programs या दूसरे health related programs जिसमें AKUH plays a very vital role. So do you guys have like set up specific strategies for what kind of communication that you're kind of going on to पहले से, या it is kind of what whenever a program happens that you develop a strategy?
Okay, no. So this is interesting. So AKU is a very complex organization. And I'm talking about AKU, I'm not talking about AKUH.
Okay.
So a lot of things that you've talked about, a lot of outreach that you've talked about, it relates to research and education. So AKU, as an umbrella, the university has multiple communicators in multiple areas. So they know their area, their department, and then they have their own strategies devised. But ultimately, everything goes up to the top and aligns with that same strategy. For example, for us, anything to do with health services, that's with us.
Okay.
So our strategy is an overarching strategy, and then within the year we have different tactics identified as to who are we going to reach out, what kind of audiences we'll be talking to.
All right. So part of what AKUH specifically, if I'm talking about, we saw especially in the recent days, a lot of doctors were coming on various platforms and they were addressing general queries. They were answering COVID-related issues. They were talking about what sort of pressures that the health system in the country was facing during this pandemic, especially. And for one thing, from a communication perspective, is that we never threw out our spokesperson without having them trained. And now you're talking about these specialists, which are very good at what they do. I mean, from the medical standpoint, but not every doctor is very communication savvy, or not everybody is. And we saw it in UK's within the health ministry of United Kingdom. We saw people struggling with those daily press conferences which was having there, and it's a kind of a global challenge that came into. You have these doctors who are very good when it comes to medical, but they are not very communication savvy. They are not trained. So how do you guys go on about that? Did you guys develop a training program? Or did you add a checklist? Okay, first we want to put the doctor in this crash course of 3 days, how to address media, how to answer those queries, and then maybe place them out? Or were they on their own?
Okay, so initially what we did was we developed a group of experts from each area, and they were all leaders in their area. And then we sat with them. We discussed what needs to be done, how it needs to be done, and then we developed a checklist of do's and don'ts. If there's anything that you don't want to answer, you don't have to answer that. If you think anything you say might have negative impact on the public perception, public idea about the disease, don't say it. So things like that. So we developed that checklist, and honestly speaking, if I talk about our experts, we didn't have to train them much, because the kind of training they're coming up with, the way they're dealing with the patients and the kind of patients they're dealing with, they are much more suitable to answer those questions and respond to the challenges. And to the point here, one of our doctors, Dr. Faisal Mahmood, um, he he he's actually known as COVID ka doctor in Pakistan.
Mm-hmm. Yep.
Here he got Sitara Imtiaz for his services to the country, and wonderful human being. And we didn't have to train him, because he's a very good communicator. He knows how to deal with not just patients, but the kind of sensitivities that come with talking to the media.
Cool. Acha, based on this, this is a very, very interesting point. There are not often time, and there are not often that we see come to a point कि जिधर हम अपने experts को we would bring them in front of the media. So what we do is कि then we identify कुछ लोग जो key opinion leaders होते हैं, maybe influencers होते हैं, and then we engage with them and then try give them the necessary information. And on our behalf, they go out to the media and try create awareness or raise issues, or provide solution or create that sort of a platform. Do you guys go into things like that, where you find these third parties and then you equip them with the necessary background information and they go and create awareness on your behalf?
Look, obviously, it always pays off to have positive voices speak for you. But when it comes to healthcare, only an expert can explain something the way it's supposed to be explained.
Mm.
I've been in this role for almost 2 years now, but I'm not a trained healthcare professional, so I cannot answer healthcare related queries. And anything that has to do with healthcare, it has to do with the expert, because it's so sensitive. One miscommunication can lead to lots and lots of people either getting sick or worse, dying. So we have to be very careful with who we collaborate with, and how do we position ourselves.
Cool. Acha, so based on this, one wrong move and obviously leads to crisis. What does a crisis look like for you guys? Because outside there's a crisis. Inside, sitting in a hospital environment, working with health practitioners, what does a crisis look like for you? It's like, if you could just share an example, maybe, because recently तो बहुत सारे crises हुए हैं.
Recently, last year and a half, almost 2 years, पूरी दुनिया ही crisis mode में है. But crisis for us is dealing with lots and lots of people, and not dealing with, managing lots and lots of people and their expectations. One thing that literally comes to my mind was right after the government announced public vaccination, AKUH was the only private hospital in the country. that was nominated by the government. And literally within a week or so, we developed our vaccination site and we were ready to deliver the vaccines. And we started. There came a point when the government announced that people who were over the age of 70 could just walk into any vaccination center. And AKUH being AKUH, everybody wanted to come to us.
Hmm.
And at one point in time, we had around 3,000, 4,000 people outside our campus. The road was blocked. Everybody wanted the vaccine. And obviously, we could not cater to so many people in one go. So, managing their expectations, managing the situation in a way that it does not blow out of proportion, and then telling people that, we're sorry.
So how do you, if you could just give us an example, how do you go on about that? Because we understood कि उस वक्त bed capacity पूरी हो गई थी, जिस वक्त pandemic was in full swing, people were waiting outside. There was some mob वाला situation also was creating at some of the locations. और बड़ा simply हमने देखा across Pakistan, hospitals kind of shut off their doors. It was silent. There was no communication. Nobody was picking up the phone, and then everybody went into a silent mode.
Yeah.
And that's their way of saying sorry. How did you guys at Akhan, kind of, because ultimately property damage na ho, koi bahar untowardly incident na ho jaye. Were you
Yeah.
guys still communicating to the general public, telling them that this is what the situation is?
Absolutely. Look, there is absolutely no way for us to be quiet about it because so agar isi cheez pe relate karte hue, if I go back to the earlier days of the pandemic, right after when the government announced the lockdowns, I think a week or so later, because we had to change our operations, there was this false fake news that AKUH is closed. It's not taking patients. To the point that there was such panic in the media that everybody was just panicking that, oh my God, AKUH, the largest hospital, one of the largest hospitals in the city, is not taking patients. Where are we going to go? So obviously, we had to clear that misconception. Yes, there were certain services that we had stopped because they were not necessary at that point in time. And we had to change our systems.
Okay, all right. That's interesting to come across. Actually, now I know how often do doctors, health practitioners, they work towards enhancing their communication skill. Now I'm not talking about emergency, pandemic situations. Generally, do you guys help out your doctors and your health practitioners with their communication skills as a communication department there? Do you guys go have regular programs on those sorts?
So no, we don't on a regular basis. But what we do is we have regular meetings with them where we discuss the challenges. And on those challenges, we come up with action points. जो action points उनके लिए भी होते हैं और हमारे लिए भी होते हैं. From a reputation, perception, communication and PR point of view. So मिलके collaborate करके we come up with solutions. So there are no formal sessions that we have.
All right, interesting. अच्छा मुझे ये बताओ क्योंकि because we saw और पाकिस्तान में especially we see के hospital का communication department या wing जो होता है that's kind of like a very small bunch of group of people working together, very close quarters. फिर मीडिया से भी वही इंगेज कर रहे हैं, जनरल पब्लिक को भी वही रिस्पॉन्ड कर रहे हैं, विद इन इंटरनल कम्युनिकेशन भी वही डिज़ाइन कर रहे हैं, एक्सटर्नल भी मैसेजिंग वही डेवलप कर रहे हैं. Do you guys go for external partners maybe to extend your outreach? Yeah, you guys don't. It's a completely entire in-house.
No, we do have external partners because look, Khurram, the way the world is moving with technology coming up, yes, it has made our lives easier, but there are a lot of aspects that we need to take care of. So yes, we have a team in-house that works on creating content, developing content, but we also have outside third-party partners who are facilitating us.
Okay, all right. That's assuring to know. अच्छा मुझे ये बताओ because I'll be running out of questions and then I think I'll open up the floor to if anybody has a particular question to you. What are the best and worst part of being a communicator in the health sector? Because you have worked on the corporate side, you have worked a bit on the agency side. You're from a design school now. That's a completely different mindset to be coming in from. What are the best and the worst parts of being a communicator in the health sector specifically? If you could just.
Okay, this is an interesting question because I'll I'll only talk about the last year and a half. It's it's not easy working in the health sector. जो बात मैंने थोड़ी देर पहले बोली थी, I'll go back to that you're dealing with people's lives. One wrong move can cause someone great pain.
Yep.
So everything that we do has to be very, precisely thought out. So the worst part is not being able to deliver upon it. And subsequently, the best part is also that at the end of the day, when you go to bed, you sleep thinking that you were a part of someone's well-being, that you took care of someone, and that's better than any money, any material gain in the world.
Cool. Spoken like a doctor, yeah. And I thought you were a comm specialist because that's the kind of a noble thought that the doctors have. Helping people continue with their lives. We
No, so-
communicators, we just kind of say it nicely. So
But to be very honest, each and every individual, if you ever get a chance to interact with people from AKUH, each and every individual who's here right now believes in what we're doing.
all right, cool.
It's beyond money, monetary gain, material gain.
Chalo yaar, it's been very sort of a very in-depth learning session for at least for me because nobody speaks about कि PR health sector में दिखता कैसे है, कौन लोग होते हैं जो काम करते हैं, और because the only interaction we have with the doctor is either we are gone there for a medical checkup या किसी relative को मिलने जा रहे हैं, so we a lot of us don't have a first hand idea okay तुम लोग किस तरह communication shape up कर रहे हो, किस तरह चीजें कर रहे हो. We have a question from Hamza Saeed, I think. So let's just open up the floor for questions. And anybody of you, if you guys want to put Anam under the spotlight, please feel free. We go turn by turn. Or Hamza, we'll start with you if you could just ask your question now. Okay, Hamza has written something. Let me just read it out to you, Anam. What strategy do you recommend for newly established hospital to market itself from communication and PR specifically? So is there a strategy that you would advise for a newly established hospital to market itself?
So see, here's the thing. So there are two things. Either you take it as a business and then you market it as a business, or you position it as helping others, taking care of people. And from a PR standpoint, every time you tell a story of how you're taking care of people, that resonates with people. And from a cultural standpoint, I don't know, we have some 17 odd people in this group right now. Almost all of you, if you're going to see a doctor or if any of your family member has to see a doctor, you will almost always ask others for their opinion. So the more you focus on telling the story of how a healthcare institution or a hospital is taking care of patients, that's what is going to position you from all others.
I think that's the right advice. I would just second that because in communication business in PR, we firmly believe that it's all about how good of a story can you tell, and if it's backed by facts and figures, and there are not all claims to it. Human tendency is that people like to connect with each other, and the believability factor comes in rather than forcing in. It automatically kind of strikes the right chord. Amir Abbasi has a question for us. Amir, if you can just go ahead.
Can you hear me?
Absolutely, sir.
Okay, ask somebody else to ask. I have a visitor here. I will come back in 5 minutes.
All right. So we're going to hold on to Amir's question. Maybe anybody else would like to take a jab at Anam because Anam has been answering fantastically. We thought we could just rattle him a little bit. So maybe one of Anam's colleague from AKU would like to ask him a question. I think that's the right time. We could just all listen to kind of inside the organization banter of sort.
I'm waiting, guys. Anyone?
Yeah, I think you have explained it pretty well. Farhad has a question. Okay, Farhad. Farhad, go ahead. Farhad, you need to unmute your mic, buddy, and you can just put your question right up. Oh, he typed it. Okay, good. So Farhad is asking, how's the service sector supposed to communicate to masses with a predefined perspective? Very interesting. What do you mean by predefined perspective, Farhad? If you could explain it,
सबसे पहले तो
so maybe that's easier for us to answer. I think instead of typing, you could just join in. That's the whole point. Okay. People have already made up their mind about a certain hospital. Okay. All right. So he's asking that people have certain disposition and predisposition against certain somebody, and maybe based on a bad experience or something. So how do you communicate to those masses if that particular community has a certain thing against that organization?
So, so, Farhan, I think this is a very interesting question, and I think this is not just true for us, but it's true for any hospital out there, from here in Karachi to United States or United Kingdom, anywhere you go in the world, because every individual has a different experience from the other. So, for example, we have a lot of patients who would come in and they cannot stop praising our experts. At the same time, we have a lot of other individuals who would come in and they would not stop talking about that said individual did not take care of them. And it's the same individual who took care of those other patients. So it has to do with how people perceive. And when you talk about healthcare, if any of my loved one is unwell, first of all, it's how I am taking care of my well-being from an emotional point of view and how I'm managing that situation. So, and I'm not saying that individually people are to blame. All I'm saying is that everyone comes with that heaviness on them. We try to take care of them to the best of our ability, to the best way possible that we can, based on the guidelines, the policies that we have. जहाँ तक रही बात masses की perception की, the only way to do that is to tell as many positive stories and to tell the world all the trouble that one person faced, how we took care of it, how we made it better for them.
Cool.
And that's how
वही नहीं अच्छा मेरे पास एक आई ऑफ कोर्स जस्ट टू टॉक अबाउट दिस हम लोग व्हेन वी टॉक अबाउट ब्रांड्स व्हेन वी टॉक अबाउट कॉर्पोरेशन सर्विसेज तो हम उसके अंदर देखते हैं कि देयर इज अ कंटिन्यूअस एंगेजमेंट विद द बीट रिपोर्टर्स फॉर एग्जांपल if you're talking about let's say an oil refinery, so we take the certain power beat के या energy sector के reporters to go visit the facilities, see it into first hand account. इसी तरह manufacturing concerns में we take the necessary reporters and give them a first hand account कि this is how the operations are going in. So it is working vis-a-vis एक capacity building हो रहा होता है वहाँ पे. Secondly, बहुत सारे rumors और बहुत सारे myths भी dispel हो रहे होते हैं on the ground. So do you guys at AKUH have this program where you're taking these media on a fam trip or maybe bringing them into the hospital and showcasing कि आप क्या कर रहे हो, किस तरह कर रहे हो?
Okay, so this is an interesting question. So Khurramji, here's the thing. We have very good relationships with healthbeat reporters and journalists. So we interact with them, we call them in for sessions. But our policy, first and foremost, is patient confidentiality and patient privacy. Nothing is more important than that. So what we do is we cannot take them to areas where patients are.
Okay.
They can come in as patients or visiting someone, but they cannot record anything because that defies all the patient confidentiality and patient privacy laws that we have.
Mm-hmm.
But at the same time, with the press, it's always a two-way communication that we have, and we've built some really good relationships over the years.
All right.
PR. In UK, the biggest healthcare PR system is NHS, and it is the biggest in the entire UK. I don't think anywhere else that many people work with that much of expertise and that much of training and development and all that. So those who are working in the healthcare sector, that is NHS, in the UK, are the highest number of communication people, PR people and communication people. So if Pakistan is anyway behind that, then that's a different discussion why it is so, because people take health related PR, health related communication too seriously here.
I'm sorry I lost you.
And the last thing that I said was that the healthcare communication which is taken, which is here, is because it is at that magnitude because people take it very seriously. And that is the reason that thousands of people are working in only communication for the health sector. So that is one of the reasons. So how serious is society about it? How serious is government about it? It all depends on that. I have two questions. How did you find government communication response during the pandemic? And my second question is, how good is health-related journalism in Pakistan?
Okay. So, Amir, I think the first one, I'll answer the first question. Economies around the world collapsed. Governments failed to respond. Pakistan, a developing country with such limited resources, managed to have such a wonderful response to COVID. And that was only possible because of how the government took.
I totally agree with you on this. I totally agree.
Absolutely, and there are good and bad days everywhere, but this the last 2 years have just been a wonderful example of how the governments came together and responded to the challenges. Especially if I talk about the Sindh government, the way they responded to the challenges from the onset, and then obviously federal government, NCOC. They've done such a wonderful job. To think there are countries that still do not have vaccines available, and we're now talking about booster doses in Pakistan.
Yeah. So Anam, just to interject a little thing. So we often talk about this public-private partnership, and in case of what Amir said, NHS being their government healthcare system, Pakistan do not have such a robust mechanism. So it's only the amount of time when the private companies or private organizations like AKU maybe comes into action and kind of fill on this void which the government does not have yet. They're yet to set up a primary healthcare across. So how do you think, how many times that this whole thing worked out, this private public partnership? Because we saw at one point in time during this pandemic, especially in Pakistan, AKUH became the primary communicator, and
Yeah.
whereas it has been in UK where it was NHS which was dealing every day press conference and doing it from a public's point of view, we saw a private company, a private organization in Pakistan taking and playing that role. Should think how has that kind of worked out for you guys, and
So,
how many times would you be interested in covering up the government side?
so Khurramji, here's the thing. One of our one of the aspects of our mission is to provide highest quality healthcare, but also enhance capabilities and capacities in all the areas we function. So this was to deliver upon that mission.
Okay.
जो यूनिवर्सिटी का जो हॉस्पिटल का एक मिशन है, and in the pandemic's case, the public-private partnership was was just so important. This could not have been possible without it, because the kind of resources the government has, the kind of reach the government has, the private sector does not have that. Private sector has other kind of resources. So it was literally like if both the parties were banking on one or the other to fill in those gaps. So while the government was preparing those responses, AKU was taking care of the public, and vice versa.
All right. Fair enough. Fair enough. Now we have a question from Hafsa, and Hafsa has wrote, "How do you think the digitalization of media has affected the PR for medical institutions? Keeping in mind all the reviews that are posted, this is related to the Facebook comments that you guys get, or the online bashing that you might see. How do you think that the digitalization of media has affected the PR for medical institution or healthcare providers?"
So I think that's a very interesting question, because see, अगर हम लोग historically देखें communications की जब बात करें, PR की बात करें, it has always been one way. Okay, companies would come out, say something, go back and never answer anything, and never talk to the people. Digitalization has made it possible for people to interact and communicate with institutions. And the more real-time feedback you get, the easier it is for you to respond to the processes. And it's a constant evolutionary process. And I think for us, it has been a learning process. It has been a humbling process, and it has made us feel proud as well.
Really fantastic. On that note, we're nearing our time, Anam, and on behalf of PR Digital Academy and people who have joined in, you have been fantastic and in answering all the questions. And I'm sure that you remain available on the WhatsApp group too. If people who are unable to join today's session, obviously they will be able to look at this recording and then follow up with follow-up questions to you on that note. So if anybody has any other question, right now is the time. Otherwise, we'll just. All right, Amir has another question. Yes, Amir.
No, I'm just because I'm moving in and out. Did you answer that health journalism thing?
No, I did not answer that because we moved into a slightly different direction. So, Amir, for us here in Pakistan, in Karachi, health journalism is probably not as advanced as you see in the UK. However, we have some phenomenal and some really wonderful health journalists who truly believe in what they're doing. And the reach that they have, the kind of following they have, it really helps in disseminating the message.
Yeah, so Amir, I don't know if you've catch on to what the earlier question was from Anam, that yes, they do outreach to these health beat journalists, they bring them in. Obviously, patient की privacy का और बाकी सारे इनके rules are in place, so they do get to engage with these health beat journalists. कुछ capacity building भी होती है, उनकी कुछ awareness भी होती है. So they are actively playing a very a leading role in developing that journalist वाला side as well, because we see कि एज कॉर्पोरेट्स हम ये ऑफन देखते हैं कि वेदर इट्स अ टेक्नोलॉजी क्लाइंट, इफ इट्स अ न्यू सर्विस इन द कंट्री, capacity building for the media, from the brand side or from the service side, is also very important, because once they get to experience that, I think that is where quality reporting starts coming in. That's where the real questioning starts to begin. Instead of कि जी एक स्टोरी है जो सिर्फ एक किसी अच्छी सी ड्राफ्ट हुई है और वो सिर्फ पब्लिश हो रही है और उसका कोई रिजल्ट नहीं आ रहा. I hope just like me, you guys have got to get a chance to learn a few things. Hamza Saeed, there was a question unanswered by Hafsa. I think Anam kind of went about it कि digital के ऊपर digitalization of media, how is that affected for PR for medical institution? I think yeah. So otherwise, we can always go back to the recording and see.
Yeah.
And obviously, Anam can be contacted at a later stage on the WhatsApp group.
Absolutely.
So thank you very much, everyone. And it has been a wonderful session. Thank you, Anam.
Thank you very much for having me here, Farah. Take care.
Take care, ji. Assalamu alaikum.